they're actually losing hundreds of thousands of dollars because they have all these crazy discounts and their their fees are not at market value. So one of the things that the biggest complaint from the profession, and I'm sure you felt this way too, is that you offer the same services as other healthcare practitioners that are not chiropractors, and they get paid more, they get reimbursed more.
Yep.
But part of the reason for that is because we set our fees so much lower. The documentation and coding requirements are exactly the same for us as they are for any other healthcare provider.
Okay, welcome Genesis Nation. I am really excited to be able to share this amazing human, and not just this human, and also the product and service that she offers. Kristi Hudson is the VP of Business Relations with ChiroHealth USA, and we're going to call it CHUSA, because I didn't know what CHUSA was before I met you, and now I know what CHUSA is. So we met recently, and I really love the concept of ChiroHealth USA because it provides a very compliant and legal way for chiropractors to get more patients in the office under cash, time of service discounts, when insurance runs out, high deductibles. And we're going to dive into all that as far as staying compliant within a network. And this is all legally formed. It's not someone didn't form this on a Friday and then apply it on a Monday. This is, in over 7,000 chiropractic offices. There's what, almost 1.5 million patients using this, and
Yes.
their families. So this is great for our cash practices out there, as well as even our practices that are using insurance and then move over to cash maintenance wellness. And then also, this is a great tool for growing your practice because it's just another network where you're tied into places that patients are looking for good chiropractic care online. So if you can just get us started, if you can give us a history first of how ChiroHealth USA was created, and then we can dive into the details.
Yeah, so it was really great. So I work for Dr. Ray Foxworth, the founder of ChiroHealth USA. He's been in practice since 1985, second generation chiropractor, graduated from Cleveland Chiropractic College. And, he started out in practice and he was offering cash discounts. And you know how it is, Brian, those first patients that come into the door and they stick with you throughout your practice. And he'd been in practice for about a little over a decade and he'd been treating this family and they didn't have insurance. And so he was giving them his cash fee when the mom was in an automobile accident. So he was treating her for those injuries and he started billing his actual fees to the insurance company. And he walked into the room one day when she was there for one of her follow-up visits. And it was one of those moments where you walk into the treatment room and you instantly know something is off. Like you can just feel the tension. And he was like, Miss Jones, is everything okay? And she was holding the EOB in her hand. She walked up to him and said, it's doctors like you who are ripping off insurance companies that prevent me and my family from being able to afford insurance.
Mm.
So here you have a family of four who's been coming in for over a decade, paying out of pocket for chiropractic care. They obviously really value those services. And she walked out that day and never came back. Like she didn't get treated, never came back in the office. And she filed a complaint against him with the Board of Examiners in the State Attorney General's office. And that was
Wow.
the day that he learned that there were all these rules and regulations about what you can and can't do when it comes to offering discounts to your patient. And so he just, like many chiropractors and business owners, he was like, wait, this is my business. Why can't I just charge and do whatever I want to?
Yeah.
But we work in the second most regulated industry in our country. The only thing more regulated than healthcare is the environment.
Wow.
And so he was like, well, insurance companies can just pay us whatever, regardless of what our fees are. So why can't we do that or extend that kind of a discount to patients? So he started looking into it and he found discount medical plans, which had been around since the 1970s. Most of them are owned by insurance companies. And in fact, were started by insurance companies. They're regulated by the Department of Insurance in most states. And he joined one. And what happened is that they reevaluated his fees, cut the amount of money that he was going to get paid. And it ended up costing him money every time a patient utilized that service. And he realized there's no one size fits all. We're in rural Mississippi, but we have practices that are in Beverly Hills, California, New York City, where the difference in fees compared to what it is here in Mississippi, the cost of living is significantly different. Heck, just
Yeah.
rent alone is significantly different. And so he decided that he was just going to start his own discount medical plan organization and he didn't want anybody to tell him what he was going to get paid anymore. And he didn't want anybody to tell any other chiropractor. So that is one of the things that really differentiates us from other organizations like us, is that we don't dictate what you're going to get paid, because again, there's no one size fits all.
Yeah.
And there's a 30-day opt-out clause. And that was the other thing that really burned him up, is that he signed up for this plan, but there was a limited amount of time where he could get out of his
Yeah.
contract.
And they
Right.
send you like a hidden fax with a small message on the bottom, right? Yeah. You don't know how the heck to get out. Yeah.
So then you're stuck losing money seeing patients,
Yeah.
right? So the heart of chiropractic is we want to serve everybody, but not to the point where we're losing money,
Yeah.
right? And
Of course.
unfortunately, that happens all too often with any type of network contract. So he was like, there's a 30-day opt-out clause. If people can get out anytime they want to, they can adjust their fees anytime they want to. And so that's what he did. He started this discount medical plan organization. And he was just doing it in Mississippi because he was just going to help him and his friends, because that's what he got in trouble for. And he wanted to educate them so they didn't get in trouble like he did for making the same mistake. And then a consultant speaker, Kathy Mills Chain, came to Mississippi to speak, and she's educating them on financial compliance and state and federal rules and regulations. And they're like, yeah, but that doesn't apply to us if we use ChiroHealth USA. And she's like, what is this ChiroHealth USA? So they go and pull him out of another classroom to tell her in the middle of her class, well, what is ChiroHealth? So she invited him to dinner that night because she wants to learn more about it. And she says, listen, I have clients that need this. We need to take this nationwide. So he started it in 2010, and then, or no, 2008. And then in 2009 is when he started taking steps to take it nationwide. I was their very first employee they ever hired. He literally
Wow.
ran out of his chiropractic office. And he hired me in 2010. And so I was like part-time personal assistant to him and his wife, did some things in the office, and then kind of worked on ChiroHealth, because at the time I think we had like 200 maybe clinics utilizing us and 10,000 patients at the time. The other thing that he really wanted, being that he'd been in this profession for such a long time, I'd been very involved in his state association, had worked for the VA Medical Center, had worked on a national level. He wanted to give back to the profession because he felt that there were just too many people who were making money off of chiropractic, but weren't supporting the profession and the long-term goals. And so that was a foundation. So a percentage of all of the money that we made would be donated back. So he was
That's great.
already giving back to Mississippi. So he established a plan that a percentage of what we made, or of every patient membership that was signed up in any state, that state would get a percentage of that. And then the Foundation for Chiropractic Progress and Chiro Congress would receive a percentage of all of the memberships sold nationwide. So that's
Wow.
how it started. And it was really interesting because I love to tell the story of he went to Chiro Congress for the first time in 2010 when he hired me. And he tells them, this is what I'm going to do. And they literally said, you are out of your mind. Like, this is never going to work. And they were like, our minimum partnership is 15,000 a year. And trust me, with as few people as we had enrolling in the program, the percentages were not going to hit the 15,000. He says, you know what? Here's what I'll do. I feel so strongly about this for the protection of the profession and giving back. I will pay the difference out of my pocket.
Wow.
So for 3 years, he paid the difference out of his pocket when we didn't hit the 15,000 minimum. And in year 4, we did. And now we give to them around 70,000 a year.
Wow.
And we do the same for the foundation. So we just topped 3.2 million given back to the profession.
That's amazing.
And now we support the Chiropractic Future Strategic Plan, the NCMIC Research Foundation, the Clinical Compass, which our mutual friend Jay is a part of. He's really big on supporting research, because where we really lack in chiropractic versus other healthcare practitioners is that we're a very young profession, and we don't have the research to validate what we already know seeing happen in chiropractic offices every single day. And research is what gets payers to pay to cover services. It really holds us back in marketing and advertising. It's just unbelievable. So we do give a lot to research for that. But there's so many other things that he helps to support, like the future of chiropractic, which is going to help to change legislation and the technology that was built and is being utilized right now with the help of Oklahoma State University, where they're tracking reimbursement and they're able to utilize that information because now we own our own info. And when an insurance company stops paying for something or bundles things or does something against their own policy against chiropractors, and they're like, oh, we're not doing this, we can say, yes, you are. And it's really great, completely off topic, but that dashboards that were created by the strategic plan and Dr. Jay Greenstein and Brad Cost from Infinity was actually used in the state of Kentucky, and their doctors just got millions of dollars back and back payments earlier
That is
this year with the help of
amazing.
that.
Amazing.
So,
It just so it's just awesome to see doctors giving back to the profession in this way because, as a solo practitioner, I felt like I was on an island for a long time, and not getting help. But now that I'm in this position, I'm reaching out and connecting to all these groups that are just helping the profession and pushing it forward. And we need companies like CHUSA and Genesis and Dr. J so that we can, propel the profession forward because we're behind with technology and just getting discriminated against with insurance companies. So can you give us an overall aspect of like if I'm a doctor and you're quote unquote selling me, so to speak, like how does it benefit my practice?
oh, absolutely. And I will tell you too, if you ever call ChiroHealth, they are never going to sell you. In fact, we will tell you how to do this without using us, but you
Okay.
like it so much you'll want to.
Yeah.
Um, so really, here's how it benefits. One of the biggest things that you have to overcome in chiropractic versus other healthcare fields is that a typical patient will see their healthcare practitioner 1 to 2 times a year, unless they have some kind of comorbidity that requires a specialist visit every 3 to 4 times a year. In a chiropractic office, they're going to see us 3 times in a week,
Yeah. Yeah, of course, a
right?
lot more. Yeah.
Maybe, 8 to 12 times in a single month. And there's a financial burden to that. And because of the big hearts that we have, and we want to see these patients, we want everybody to be impacted by chiropractic, we're going to offer a discount. Well, unfortunately, if you're in network with any insurance, you're seeing Medicare patients, do PI, workers' comp, any of those things. You cannot do that. You just can't give a discount. Like you can do a time of service discount of 5 to 15% according to the federal government. Oftentimes, I will ask doctors about those time of service discounts and they'll say, absolutely, it's only 10%. Then we start doing the math. It was 10% 15 years ago.
Mm,
It's like 30, 40, 50% today.
wow.
um, you start violating those insurance contracts and then you start getting these post-payment audits and there's all these other issues that come into play, the with the limitations that we can do. But now with a network contract, similar to insurance, again, we're not insurance, but with that, in the contract, if you have a contractual agreement, you can agree to a lesser fee, and that is legal and compliant. So that is the way it's set up. But again, we don't tell you what you're going to get paid. We guide you in making the right decision because we don't want you to you can't discount your way to success, bottom
Yeah.
line.
Yeah.
And what we found working with almost 7,000 providers around the country is that about 80% of this profession that we've worked with, it doesn't even charge what the highest payer in their state allows.
Mm,
They're actually losing hundreds of thousands of dollars because they have all these crazy discounts and their their fees are not at market value. So one of the things that the biggest complaint from the profession, and I'm sure you felt this way too, is that you offer the same services as other healthcare practitioners that are not chiropractors, and they get paid more, they get reimbursed more.
yep.
But part of the reason for that is because we set our fees so much lower. The documentation and coding requirements are exactly the same for us as they are for any other healthcare provider. Why are we charging less for an exam? Why don't we
Is that
charge
just
market value?
because is that just something that happens across the industry and it doesn't need to be happening?
Yeah, oh, yeah, absolutely. There's almost like this poverty mentality. It's like, oh, it's so expensive. So we have to like discount our services so people will use us. The problem with that too is then really it devalues the services
Of
that
course.
you're offering to your patients because in their mind, for example, if you have a $25 adjustment, then that's what it's worth. When in reality, that is the most valuable service you provide.
Yeah.
Like,
More than therapeutic exercise and rehab and things like that.
yes.
Yeah, it's your hands on somebody, removing subluxation, changing posture, correcting health, changing lifestyle. Yeah, I mean, we can go on and on with that, of course.
Oh yeah, absolutely. But there's this tug of war inside of I want to help every single buddy, but I want to be profitable. And so we give you the resources so you can at least look and see what is the market value. And it's determined by zip code in a state,
Okay.
right? So what's going to work in my zip code is going to be a little bit different from your zip code or even in 5 other cities in the state of Mississippi. So that you can make a good decision about where your fees should be. Even if you're not seeing PI and workers' comp and you have a published fee schedule in your state, in almost every state, workers' comp is the highest paid fee schedule in the state.
Yeah.
And so it needs to be a guideline. If workers' comp is willing to pay you $100 for an adjustment and you charge 25, they're not going to pay you 100, they're going to pay you 25.
Of
So
course.
you
Yeah.
lose $75 every time you build this out. But here's the other thing. Our state associations are battling workers' comp boards to keep them from lowering the reimbursement rates because their providers won't even charge what they allow. So
Yeah.
it's this huge tug of war. And what happens when workers' comp lowers their fee schedule? Then the PI fee schedule lowers, then payers lower the fee schedule, and it becomes this endless cycle. So if we don't start valuing our services, we absolutely cannot expect that payers are going to value those services either. And ChiroHealth USA gives you the benefit of being able to charge market value and bill at that rate and still offer an affordable option for your patients when that discount needs to exceed that 10 to 15% limitation. And then the other thing we're going to help you do is walk you through what is your cost of doing business? Because as a chiropractor, there's a dollar amount every single time you walk into a treatment room that you have to make to break even.
Yeah, of course.
Most doctors don't know that. They
Yeah.
don't know that. They're like, I'm seeing more patients than ever before.
And the
And
money's not in my bank account. Yeah.
right. They're like, I can't even pay myself.
Yeah.
I walked through this exercise with a friend of mine one day, and he was making 65 cents a visit.
Oh,
And I was like, where did you get
I
these
just
crazy numbers?
I just got nauseous. Sorry. That's just horrible.
So he's working himself to death, seeing more
Yeah.
patients than ever before, and not making any money. And that is the fast track to burnout. And I feel like a lot of the stress that we feel in this profession, that chiropractors feel as business owners, is I am killing myself and I'm working so hard and I am not making any headway.
Well,
Like I am
physically, emotionally, spiritually, it's not like you're just signing documents. Like we do very physical, emotional delivery of care. So let's say chiropractor joins up with CHUSA.
Mhm.
You're going to do an analysis first, right? You're going to say,
Yes.
okay, what is the market value of X, Y, and Z procedures that you're doing? And then how does the actual discount aspect work? Because I'm a little if you could break it down to kindergarten language for me.
Sure. So, like, after we go through that whole analysis and we evaluate your actual fees, in most cases, most doctors are like, okay, I need to raise my fees.
Increase, right.
Yeah. And a lot of times, what their fees were prior to that or what discounts they already have in place, we just make that your ChiroHealth fee. So a couple of the things that we put into our ChiroHealth fee schedule that I think are super valuable are the first is a cap fee for a new patient visit. So when a patient calls your office, the most common question your front desk gets all day is how much does
How
it
much?
cost
Yeah,
to see the
always.
doctor?
Yeah, yeah.
It's like, well, let me look into my crystal ball because we have no idea what's going to happen when they walk through the door. We don't know what their insurance is going to cover. But 99% of the time, they're asking this question because one, they know they have stinky insurance,
Yep.
they have a high deductible, they have limited benefit, or they have no insurance whatsoever that covers chiropractic care. So they just want to know what I'm going to pay out of pocket. And so we give them the range, right? We teach our front desk to be shady and not answer this question. And it's like, well, it's going to be between $300 and $500. And the person on the other end of the line heard $500, right?
Always. They always hear the higher number. Yeah, of course.
Right. So they hang up and they call somebody else until they find a price that they can afford. When we added that feature of the cat fee, it gave the front desk the ability to say, well, it really depends on what the doctor finds necessary and what the insurance will cover. And then we let them tell us why they're asking this question.
Mm.
Think no problem. The typical new patient visit is between $300 to $500. However, we have this program in our office, ChiroHealth USA, that you can join today. It's $49 and it covers you and all of your legal dependents. Under ChiroHealth USA,
Wait,
the
time
most
out. That's amazing. Wait, $49. Is that for the year?
that's for the whole year. It doesn't
So
matter if
so
you're the debtor.
I have 2 children. So my family of 2 kids, I can 2 children, I can $49, they get chiropractic care for or according to this plan. Wow.
Yeah.
Awesome.
You can be the Duggars with 19 kids and 20 kids and counting wherever they are. All of your legal dependents under age 26, if you have elderly family members living in your home, age 60 or over, they're also included in that plan, as well to get the benefit of the chiropractic.
And can you explain or does this have to be done one-on-one with you, or can you tell me, like, what does it look like for the patient then? Let's just use the new patient, visit, for example. So if they were a CHUSA member, and they said, "Okay, I'm gonna do that," what's the additional cost out of pocket? Let's say they had no insurance. If we can use an example, I know it's different state to
Okay.
state, obviously.
So, well, and I will say this, Cover Health is used for any non-covered service. If they don't have insurance, it covers pretty much everything. So whatever the discount is set. So like say the new patient visit, which is $300 to $500, and let's just say for easy Kristi math, we're gonna do it at $150 is the cat fee. You collect $150 from the patient and you write off the rest just like you would with insurance. Difference is you're not submitting claims. You don't submit claims to us. We don't pay you anything. The patient pays you right then, and you write off the difference like you would in an insurance. It's a done deal right then.
And you can legally write it off because you're part of, sorry, I just wanted to get this term, you're part of the discount medical plan organization, DMPO. Okay.
Yes,
So, you're in that network, that DMPO, which is ChiroHealth USA, that allows you to write that off versus being at risk for fee splitting or,
absolutely.
offering those discounts. So that's really important, docs out there, that you guys got your T's crossed and your I's dotted as far as legal and compliance. I was always concerned because, I'm basing it off of what, some attorney in New Jersey told me about what's going on in Maryland where I was practicing. I'm like, all right, I got to talk to someone in Maryland at least. But so you're able to look at state guidelines for each, because even on your website it says, there's different rules for California, different rules for Rhode
Oh,
Island, and
yeah.
so every state has its rules.
Every state does have its rules, but this will work everywhere. Now, the only state that we're currently not in 2 states right now. We're not in Rhode Island, and we're not in the state of Washington, at the moment. They have the DMPOs are allowed, we're just not registered to do business in those states at the moment, but we will be. Like, we'll be in all 50 states within the next 48 months. Not 48 months, 24 months. There's a lot of paperwork and things that go into all of that to
Of
get
course.
registered within a state, and it's just a process. So we're in that process and we're working on some things with that. And so we'll be back in all 50 states.
Great. So
Uh,
how does this like how does it help me grow my practice?
so it offers you the ability, so you're not restricted by that 10 to 15% discount. So you're able to legally offer this discounts. The other thing is with that cat fee for the new patient visit, especially. So when we implemented that, and I will use Dr. Foxworth's practice as an example, it was the number that we tracked was how many of those people actually made an appointment and showed up. And it was between 90 and 95%.
Mm, that's
Which is so
awesome.
interesting to me is that the number one question that I hear, like the biggest area of interest, especially like in my webinars, everybody wants to talk about marketing for new patients. Your phone rings all day with potential new patients. They don't need to be sold on chiropractic. They called you because they
Yeah.
know you can solve their problem. What they don't know is can they afford you?
Yeah.
And so when you resolve that issue, then they just show up.
Yeah, it's that objection of money. Yeah, it's always there, money and time. That's
Money and
great.
time, and, so that's one of the things. The other thing that we have to face is that, one of the big thought processes behind patients or a hurdle that we overcome is that you have to go to a chiropractor forever when the reality is you'll want to, right?
Yeah,
Um,
yeah.
and so having that conversation, after the new patient visit, when you do the clinical report of finding, then immediately having a financial conversation that says the doctor has recommended 15 visits of care. And based on your insurance information, this is how much you will owe out of pocket because they're scared they're going to get some huge bill in the mail that they're not going to be able to afford.
Yes, always.
Right. So we're going to overcome that. We're going to go ahead and let them know about that. So if they do have insurance, let's say they have limited benefits, like insurance isn't stupid. They cover 6 to 8 visits because they get the patient out of pain.
Yeah.
And
Not they're not teaching lifestyle. They're not promoting or
no,
providing access for lifestyle. Yeah.
right. One of the things I remember when I first started in his chiropractic office is we used to tell patients when pain ends, healing begins. There's a reason why we want you to feel better by visit 6. There's a reason why we're asking you to come in for 12 or 15 visits, right? You're pain free, but you're more susceptible to injury if you do not complete care.
I love that. When pain ends, healing begins. So what are the biggest risks? Like when you obviously talk to thousands of offices every day, or month, like what are the biggest like mistakes or things that you see people making as far as risk and compliance are concerned?
Free services, free services. Stop giving stuff away for free. Not only is it a bad business decision, if you ever see the crazy headlines, doctor, $700,000 in fines and penalties, $350,000 in fines and penalties, it is because of a free service.
Mm,
Case in point, there was a doctor in Iowa a couple of years ago who gave away free stem to all of his patients because some insurance paid for it, some didn't. Medicare didn't. He felt his patients really benefited from stem. And if it was recommended as part of the treatment plan, he didn't charge anybody for it. He had an incredible healthcare attorney who negotiated an $89,000 fine
oh,
because it should have been hundreds of thousands of dollars just based on because it would have been an inducement violation because there were some Medicare patients that were involved in that. It could have been a kickback issue, which also has that's a criminal offense, so there's
yeah.
jail time associated with that. And it could have been a False Claim Act violation because every service you offer has a value.
Yes.
So when you give it away, you're just now violating all kinds of rules and regulations. If you're a network with insurance, you're now violating your provider contract. So
Mm,
you have state issues, federal issues, third party payer issues, and it piles up. So do not give away free services. It's bad business and it will also get you in
a
huge,
lot
huge
of a lot of
trouble.
trouble. Yeah.
It does. And it's
It's
really
crazy that you're thinking that you're doing something good and you could end up in jail. And that's not for like what our forefathers were doing in chiropractic for adjusting people to get them well. We're just actually helping people and man, all right. So no free services. Any other
no
good
free
tips?
services.
Yeah.
Um, it's not that complicated. Right? So you're a chiropractor, but you're also a business owner. It's as
Amen.
simple as that. That is 2 different hats, and there's 2 different decision-making processes here.
Yes, always.
Before you can be a chiropractor, you've got to protect the business because without that office, there is no helping your patients.
Yep.
And so you gotta think about it from a business perspective. How do I become profitable? How do I remain profitable? Because not only is your family depending on you, your patients are depending on you. The team that works with you is depending on you
Yep.
to keep the lights open and the lights on and the doors open, right?
Mhm.
So you've got to remove that poverty mentality and the I want to help everybody. You've got to remove that to make good financial decisions, setting up your fee structure correctly and making sure that you're being compliant because you're protecting your license and the livelihood of everybody who works in that building.
Mm.
Then you get to be a chiropractor and you utilize something like ChiroHealth USA to offer that affordable option legally and compliantly. And
And
it obviously it's an
and
easy
and
conversation.
and you definitely use Genesis to help run the engine underneath with technology, of course, right?
Absolutely, absolutely. You know, but people are like, well, my patients aren't going to pay $49. One point, over 1 million families are paying $49 a year to utilize the program. So yes, they absolutely will
They are
because
using it. Yeah. Yeah.
they're using it. I mean, how many of you who are listening have a Sam's Club or a Costco membership? We pay for that so that we can buy 5 gallons of mayonnaise and 500 rolls of TP that we do not need, right? But we pay
Right.
for it
Yeah.
to
Yeah.
get the discount, and it's
We
a
do.
similar concept. And these programs have been around for years. A lot of times we have doctors like, "Well, can I pay for it for them?" No, because that's now an inducement violation.
Yep.
"Can I
Yep.
give it away for free and pay
No.
for it?" No, because it's an inducement violation.
That was rule number 1. No
Rule
free
number 1.
services. Yes.
And also it could be a kickback issue. And I mean, it's not like these fines and penalties are little. I mean, they're like 10, 12, 15, $25,000 for each instance. I
Yeah,
mean, like
that
I
that
tell people,
that hurts any practice, any
what
business owner. Yeah.
well, I use the example of like just say a Medicare patient with like one free therapy in your office. They're coming in once a week for 4 weeks. That one patient could cost you 40 to $60,000 in fines, and nobody's
Ugh,
seeing one Medicare patient.
ugh, that's
And it
horrible.
could get you kicked out of Medicare, and if you get kicked out of Medicare, you get kicked out of everything else. You
Yeah.
wanna be a cash practice, do it on your own terms. Don't be forced into it because that is n I mean, it is unbelievable. It's a process to move into a 100% cash practice, and there are significant limitations to being able to do that.
Well, I wanna if you can, I know you're not a compliance officer per se, but you have a lot of knowledge around legal and compliance. So even cash practices are under the restrictions, I guess, of just practicing as a healthcare practitioner in the United States. So it's not like we can't just
Oh.
willy-nilly, even with cash practice. So as far as taking notes and being compliant with how you're charging your patients. So do you have a lot of cash practices that are just using or that use ChiroHealth USA outside of insurance practices?
So we do. We have cash practices that use us, or mostly cash practices that use us. We have insurance practices who use us to transition to be a cash practice. And I will say, I am a certified professional compliance
Oh, you
specialist.
are? Okay, good.
I
So
do.
so your word is gold.
Yeah, I get 40 hours of continuing education to keep that certification.
Great,
So,
great.
um, and y'all think y'all's hours are tough. I'm just saying.
It's a
Um,
different it's a definitely a different world for sure.
It is a different world. It so, yeah, I mean, if you are a chiropractor and you have a license, there are rules and regulations that regulate what you do. It does not matter if you take insurance or not. Doesn't matter if you can call yourself all cash, but literally to be all cash, you can file no insurance claims for out-of-network provider for out-of-network insurance. You cannot be in network with any insurance. You cannot see, touch, a Medicare patient at all. If a
Mm,
patient is hurt in an auto accident or at work, you have to refer them to somebody else. When a patient becomes Medicare age, you have to refer them to someone else. Like there are very strict rules, but it does not alleviate your responsibilities of proper documentation or proper coding.
yep,
Like everybody has to do that.
yeah,
And it's
no
not
matter
that
what.
hard. It's not that hard.
Well, I'm gonna shamelessly plug Genesis again, especially when you use Genesis. It's very easy with documentation and coding. So, any other like big risk factors that you quickly see within practice? So we got no free services. Um, the second aspect, I think that one kind of spread a little wide where we're
Yeah, it
going
did.
with cash and notes and documentation. Any other quick tidbits you can give us as we wrap up?
I mean, really, that's like the biggest one. And then just being mindful of those discounts because, like I said, most of the time doctors think they're doing these 5, 10% discounts. But when you actually look at the numbers, it's not. It's 30, 40, 50, 60%
Mm,
discounts. Again, not good for business and then violating all kinds of rules and regulations. There is a balance to helping your patients have access to affordable chiropractic care. Um, and doing the right things for the right reasons in the right ways, like being compliant and doing those things that the government doesn't make these rules and regulations to just make life complicated, right? The documentation requirements are really not that difficult. You know that, Brian,
yeah,
right? We overthink it and we complain because we have to do this work when all we want to do is treat patients. But it's not that hard to follow the rules and regulations. And at the end of the day, when you are operating compliantly, you're business runs more efficiently, it runs more profitably, and you're not only protecting yourself, you're helping to protect your patients.
And
And a lot
your staff, and you can sleep
Right.
easy at night. It's like peace of mind. That peace of mind when you know you can go to bed, you're doing things right, and you have things like Chusa to help you, people like you, things like Genesis, because we have a lot of our compliance is built in. Um, Well, this is absolutely amazing. So like, I'm upset that I'm learning about this now, and I'm really glad that we can offer it to all of our Genesis Nation clients and people and tribe. And also, I'm excited to just see you out in the field and get this out to more of our profession so we can help grow and, be able to fight against these larger organizations that are, trying to tear us down. So I really just I haven't met I haven't it's Dr. Foxworth. Did I get that right?
Yes, he doesn't travel and get out as much anymore these
I mean,
days. I
he's
mean,
been around, so he's like I look at him as an elder, and I really respect his drive and passion for, bringing the profession together when it sometimes seems so disjointed. So for him to align, through compliance and ways for patients to get better access, just thank you. And thank you for doing your job. So
well, it's absolutely my pleasure, and I will say that's like his primary focus is today. It's really just really bringing the profession together and moving it into the future as the number one healthcare choice
awesome.
around the world, not just in the US. And I will add this too, that the average new provider will see a 20% increase in revenue the first year that they implement CHUSA. And that's the average, which means quite a few of them have much bigger because they realize they've been undercharging for so long. And again, we're going to tell you how to do this without us. We'll tell you exactly what to do,
Yeah,
or
but
you do
why
it with
reinvent the
us.
wheel? Just call Kristi, click on the links below, and we'll have everything on our socials and this video as well. So please give Kristi a call and get your practice up and running in a more efficient and compliant way. So thank you so much. I appreciate your time.
Thank you, Brian. I appreciate being here today.